leadership. I wanted to find out from you, given the late Saturday drama that happened, what were some of the persuasive arguments that you made to leadership about making sure the bill was as inclusive as possible and included constituents that you represent?
So one of the, you're absolutely right. In answering your question, let me just say that I know that there were members of Congress who were hearing from a lot of Americans who were saying it would be crazy for us to have someone who's willing to pay the full cost of a health insurance plan to deny them that opportunity simply because of their immigrant status. And because there were a lot of people who were making phone calls, reaching out to their members of Congress throughout the country, it made it more possible for us to keep the bill from becoming crazy, from doing things that would have cost taxpayers more money. Because ultimately, if you're willing to go out and purchase your own policy, 100% your own cost, no assistance from the taxpayer, and you're told no, well then you're not going to get insured. And at some point you will get sick, and at some point it will cost you too much money, more than you can afford, to go to that hospital or to see that doctor. And at some point then, when you get that health care, it's going to cost the taxpayers because you won't be able to pay the entire bill. And so many of us believed it was just crazy to have the taxpayers in a reform bill pay more money out of pocket when unnecessary. And so fortunately there were a lot of people who helped us by making phone calls to their members of Congress from other parts of the country. And that's one of the things that really helped us make sure that we were able to keep the bill from becoming irrational. But that's just one step. Now we have to make the same fight in the Senate. Quite honestly, we have to talk to the administration, because the administration hasn't been a friend on this issue. And we need to persuade them that no taxpayer should have to pay more for health care in taxes than we already pay. And no person who's willing to pay full freight, the entire cost of the health insurance policy, should be told or should be denied a chance to be able to get health care coverage if they're willing to do it with their own money. Because in this country, it does cost a lot of money, and we don't need to put more of the burden on taxpayers when people are willing to be responsible enough to pay for it themselves.